Hey everyone, and welcome to another deep dive. Today we're tackling Ifabotuzumab. This potential cancer treatment is seriously fascinating. Our deep dive today is going to be based on some incredible research from Assay Genie,
Hmm?
and let me tell you, it's really cutting-edge stuff. I mean, some of it sounds like it's straight out of a sci-fi movie, but could it actually work?
It really could. What we're looking at here is potentially a major breakthrough in cancer therapy.
Okay, so first off, Ifabotuzumab. Even the name sounds kind of intimidating, right? Can
Yeah.
you break it down for us? Like, what exactly IS it, and how's it different from the cancer treatments we already know about?
Well, yeah, it is a mouthful, but the science behind it is actually pretty elegant. Ifabotuzumab is what we call a monoclonal antibody. So basically, it's a protein that's created in the lab and designed to bind to a very specific target, almost like a microscopic seeker missile, you know?
Oh, I like that, a microscopic seeker missile. So what is it seeking out? What's the target?
The target is something called a receptor. It's called EphA3. And the really important thing here, the key is that EphA3 is mainly found on the surface of cancer cells and the surrounding tissues that kind of help the tumor grow. That whole area, we call it the tumor microenvironment.
So it's not going after healthy cells like with chemo or radiation.
Exactly. That's the beauty of it. By targeting EphA3 specifically, ifabotuzumab is designed to pretty much leave all your healthy cells alone.
And that means,
Potentially way fewer of those nasty side effects that people usually get with traditional cancer treatments.
wow, that's amazing. But okay, how does it actually work? I mean, does it just like blow up the cancer cell when it finds it?
It's actually a bit more complex than that, more strategic, I guess you could say. It's
Yeah.
kind of got a two-pronged attack. So first, by binding to EphA3, it basically flags the cancer cell for destruction by your body's own immune system.
Oh, so it's like calling in backup.
Exactly, like sending a signal to your body's defenses saying, hey, here's the enemy, come and get it.
So it's not just fighting the cancer directly, it's recruiting my own body to join the fight.
Exactly. But there's another clever part to it as well.
Oh.
The second part of the attack is all about disrupting the signals that allow the tumor to build its own blood vessels. Essentially, it's like cutting off the tumor's supply lines.
So it's like starving the enemy and cutting off reinforcements all at the same time.
Exactly.
Wow, I'm starting to see why everyone's so excited about this.
Yeah, and this is especially important when you're talking about a cancer like glioblastoma. It's a really aggressive type of brain cancer. Glioblastomas are known for growing and spreading really quickly, so being able to target both the cancer cells themselves and their support system, well, that could be a major game changer.
That totally makes sense. And I'm guessing this could be helpful for other cancers too, right? I mean, the article mentioned EphA3 being found on a few other types.
You're absolutely right. EphA3 is actually found in a number of other solid tumors as well, things like lung, breast, and prostate cancer.
So this one treatment could potentially be effective against a whole range of cancers.
That's the hope. The research is still ongoing, but the early results are definitely looking promising.
That's incredible. Now, there was one thing in the article I wanted to ask you about. It mentioned something called a biosimilar.
Oh, yeah.
What is that exactly? And why is it important in the context of this research?
That's a great question. So, a biosimilar is basically a near identical copy of an existing biologic drug, just like ifabotuzumab, kind of like the generic version of a brand name drug. They have to go through really rigorous testing to prove that they're just as safe and effective as the original, but they are often way more affordable.
Oh, so that means if Ifabotuzumab really takes off and they can create a biosimilar, it could potentially help a lot more people access this treatment.
Exactly. Biosimilars are a crucial part of making sure these potentially life-saving treatments are more affordable and available to everyone who needs them.
Wow. Okay. I know it's still early days,
Mm-hmm.
but this is some really groundbreaking stuff.
Oh, for sure. We're just scratching the surface here. Ifabotuzumab represents a totally new way of thinking about how we approach cancer treatment.
It really does. It feels like we're on the verge of a major breakthrough here.
I think so too.
This is all so exciting.
Yep.
I can't wait to dive in even deeper
Me too.
and learn even more about Ifabotuzumab.
Let's do it. It's amazing, isn't it? Like how much our understanding of cancer has changed, even just in the last few decades. It wasn't that long ago that the treatment options were pretty limited, and the side effects were often just brutal.
Yeah, it's crazy how far we've come. And what I find really interesting about this Ifabotuzumab research is that it's really challenging the way we think about fighting cancer. It seems so much more sophisticated than just trying to, like, blast the cancer cells with radiation or chemo.
Absolutely. For a long time, the focus was really just on destroying the cancer cells directly. But the more we learn, the more we realize how important the tumor microenvironment is. It plays a huge role in how cancer grows and spreads.
So it's not enough to just kill the cancer cells. You got to take out their support system too.
Exactly. It's like imagine trying to conquer a fortress without, cutting off its supply lines or weakening its defenses. You might win a few battles, but you're not going to win the war.
That's a great analogy. So it's kind of like Ifabotuzumab is a double agent working from the inside to sabotage the cancer's whole operation.
I like that. And that's what makes it so potentially powerful. By targeting EphA3, it disrupts the communication between the cancer cells and those surrounding tissues. And basically, it's weakening the tumor's defenses from within.
And it's doing all this by recruiting your own immune system to help. It's like turning the enemy's weapons against them.
Exactly. That's the beauty of immunotherapy. It harnesses the power of your body's natural defenses to fight the disease. And ifabotuzumab specifically, it triggers a process called Antibody-Dependent Cellular Cytotoxicity.
ADCC.
Yeah.
That sounds pretty intense.
I know, right? It sounds complicated, but it's actually pretty simple when you break it down. So imagine this. When ifabotuzumab attaches to the EphA3 receptor on a cancer cell, it's like sending up a signal flare that only your immune system can see.
Oh, so it's like a secret message
Yeah.
alerting your body's defenses that something's wrong.
Exactly. And that flare attracts these immune cells like natural killer cells and macrophages. They're basically your body's elite soldiers, right?
Yeah.
And they recognize the cancer cell as an intruder and destroy it.
Wow, so it's like a microscopic military operation going on in there.
Pretty much. And the more we learn about the immune system, the more we realize just how much potential it has for fighting all kinds of diseases, including cancer.
Okay, I get that. But I'm still a little fuzzy on how ifabotuzumab actually disrupts the tumor microenvironment itself. We talked about cutting off the blood supply. But how does it actually DO that?
Right. So remember how we were talking about EphA3 being involved in tumor angiogenesis?
Yeah.
That's how tumors build their own blood vessels to get the nutrients they need to grow.
Right, like how cities build roads and stuff to support a growing population.
Exactly. And just like a city needs those roads to function, a tumor needs a steady supply of blood to survive and grow. But that's where ifabotuzumab comes in.
Okay, so how does it stop those blood vessels from forming?
Well, when it binds to EphA3, it interferes with the signals that control blood vessel formation. It's like disrupting the communication between the tumor and the construction crews that are trying to build those blood vessels.
So the tumor's like, hey, I need more blood vessels over here. But because of ifabotuzumab, that message gets lost.
Exactly. And without that steady flow of blood, the tumor basically gets starved. It can't get the resources it needs to grow and spread.
Wow, that's incredible. It really makes you appreciate the complexity of all this and the brilliance of the people who are working on these treatments.
I know, it's really inspiring stuff.
Oh, before I forget, we were talking earlier about biosimilars and how they can make these treatments more affordable. Could you talk a little bit more about that? I think our listeners would be really interested to hear more.
Sure. So, as we said, a biosimilar is basically a highly similar version of an existing biologic drug, like ifabotuzumab. And they're developed after the patent on the original drug expires, which is why they're usually cheaper.
So it's kind of like the generic version of a brand name drug.
Yeah.
You get essentially the same treatment, but at a lower cost.
Exactly. But it's important to remember that biosimilars still go through super rigorous testing and approval processes. They have to meet the exact same standards of safety, purity, and effectiveness as the original drug.
That's good to know. We often focus on the science and the breakthroughs themselves, but the cost and accessibility of these treatments are a huge part of it too. I mean, what good is a cure if people can't afford it?
Absolutely. Biosimilars have the potential to make a huge difference in terms of giving people access to these life-saving treatments, especially for these more complex and expensive therapies like monoclonal antibodies.
It's amazing to think that in the future, treatments like ifabotuzumab could be available to so many more people around the world.
That's the goal, to make these incredible advances benefit everyone, not just a select few.
For sure. But even with biosimilars, I imagine there are still challenges when it comes to actually making sure everyone has access to these new therapies.
Yeah, you're right. Biosimilars are a huge step in the right direction, but there are definitely still hurdles to overcome. One of the biggest is actually public perception and education.
What do you mean?
Well, there's sometimes a misconception that biosimilars are somehow inferior to the original biologic drug just because they're not exact replicas.
Like that whole generic versus brand name thing.
Exactly. But it's really important for people to understand that biosimilars are held to the same incredibly high standards as the originals. They go through tons of testing to make sure they're just as safe and effective.
So it's about educating people, both patients and healthcare providers, about the science behind biosimilars, making sure they understand that these aren't just some cheap knockoffs.
Right, they're carefully developed and rigorously tested alternatives.
I agree. It's not just about the science itself, it's about ethics and fairness, too. Everyone deserves access to life-saving treatments, no matter how much money they have.
Absolutely. Biosimilars have the potential to really level the playing field when it comes to healthcare.
I feel like we've covered so much ground already. From the science of Ifabotuzumab itself, to biosimilars, to the bigger picture of healthcare accessibility.
Yeah, it's been a great conversation.
But before we wrap up this part of our deep dive, I have a question for you and for our listeners. We've talked a lot about how promising Ifabotuzumab is, but like with any new treatment, there are always potential risks and unknowns.
Right, of course.
So what are some of the challenges or setbacks that researchers might run into as they keep studying Ifabotuzumab? And how might they address those challenges?
That's a good question. I think one potential challenge with any targeted therapy is the possibility of the cancer developing resistance to the treatment.
Oh, like how bacteria can become resistant to antibiotics.
Exactly. Cancer cells are constantly evolving and changing, right? And over time, they might find ways to evade the effects of ifabotuzumab.
That's kind of scary. So what can researchers do about that?
Well, one approach is to use ifabotuzumab in combination with other therapies. That way, you're kind of hitting the cancer from multiple angles at once, which makes it harder for it to develop resistance.
So it's like a multi-pronged attack.
Exactly. It could be combined with chemotherapy, radiation, or even other immunotherapies. The idea is to basically overwhelm the cancer's defenses and prevent it from adapting.
That sounds like a pretty smart strategy.
It is.
Yeah.
But of course, combining multiple treatments does add some complexity. You have to be really careful with the planning and monitoring to make sure it's safe and effective for the patient.
Yeah, that makes sense.
But the potential benefits can be huge.
And hopefully in the future, we'll have even more advanced therapies that can address these challenges even better.
Oh, absolutely. The field of cancer research is moving so fast. New discoveries are being made all the time. It's very possible that in the not-too-distant future, we'll have even more sophisticated and targeted treatments that can basically outsmart cancer's defenses.
That's really encouraging to hear. It seems like the future of cancer treatment is pretty bright.
I think so, too.
It's amazing to see all the effort and innovation that's going into fighting this disease.
Yeah, there's still a lot of work to be done, but we're definitely making progress. And with breakthroughs like ifabotuzumab, I think we're getting closer and closer to a world where cancer is no longer a death sentence, but a manageable condition.
That's an amazing thought. Well, I think we've covered a lot of ground today. We've gone deep into the science behind Ifabotuzumab, talked about the potential benefits and challenges, and even looked ahead at what the future might hold for cancer treatment.
It's been a really great conversation.
And I want to thank you for taking the time to break all this down for us.
You're welcome.
It's so important for people to understand this stuff.
I agree. The more we all know about cancer and the advances that are being made in research, the better equipped we are to make good decisions about our health.
Absolutely. So to everyone listening out there, keep learning, stay curious, and don't lose hope. The future of cancer treatment is looking brighter every day, and breakthroughs like Ifabotuzumab are paving the way. Thanks for joining us for this deep dive, and we'll see you next time.
Well, it's always tough to predict the future with these things. But I think if we look at the research that's been done so far and the trends we're seeing, we can make some educated guesses about what might happen with Ifabotuzumab.
Okay, so what's your best guess? What's the most likely scenario here in the next few years?
Well, if these clinical trials keep showing positive results, I think there's a really good chance that Ifabotuzumab will get approved by the regulatory agencies for treating glioblastoma.
That would be huge.
Yeah.
Especially given how few treatment options there are right now for glioblastoma.
Absolutely. It would be a major step forward for patients who are fighting this really aggressive form of cancer. And once it's approved for glioblastoma, I think we'll see a lot more research into its potential for other types of cancer as well.
Oh, like a domino effect.
Yeah, exactly. If it works in one area, it makes sense to see if it can work in other areas where EphA3 is overexpressed too. We already know they're looking at it for lung, breast, and prostate cancer. So those would probably be the next ones in line.
Makes sense.
Well,
But you mentioned earlier that one of the challenges with targeted therapies is the possibility of the cancer becoming resistant to the treatment.
Hmm.
So how might that affect the long-term outlook for ifapuzumab?
That's a really good question, and it's something that researchers are definitely working on right now. I think one promising strategy is to use ifabotuzumab in combination with other therapies. So instead of just using one drug, it would be part of a more comprehensive treatment plan. So you might combine it with chemo, radiation, or even other immunotherapies. The goal is to attack the cancer from multiple sides at the same time, make it much harder for it to develop resistance.
That sounds like a really powerful approach.
It is, but it does require careful planning and monitoring, of course, to make sure that the combination is safe and effective for each individual patient.
Yeah, that makes sense.
But the potential benefits are enormous.
And hopefully in the future, we'll develop even more advanced therapies that can overcome these resistance mechanisms even better.
I think that's a safe bet. This field is moving so quickly, there are constantly new discoveries being made. Who knows what we'll be able to do in a few years?
It's exciting to think about. It really feels like the future of cancer treatment is full of possibilities.
I agree, there's definitely still a lot of work to do. But we're making progress. And I think with breakthroughs like ifabotuzumab, we're moving closer and closer to a world where cancer is no longer a death sentence, but a manageable condition.
That's amazing. Well, I think this has been a really insightful deep dive. We've explored the science behind ifabotuzumab, talked about the potential benefits and challenges, and even taken a glimpse into the future of cancer treatment.
Yeah, I've really enjoyed our conversation.
And I want to thank you again for sharing your expertise with us.
My pleasure.
It's so important for people to have access to this kind of information.
Absolutely.
The more we know about these advances in cancer research, the more empowered we are to advocate for ourselves and our loved ones. So to everyone listening out there, keep learning, stay curious, and never give up hope. The future is brighter than ever, and breakthroughs like ifabotuzumab are leading the way. Thanks for joining us, and we'll see you next time for another deep dive.